When I got about 16 years old, I noticed that I had a tremor in my right hand. Parents didn't take me to a doctor to get it checked out ever. And it kind of got worse as I went along. I was tired all the time. Fingertips would go numb. All of those moments point to multiple sclerosis.
MS is an autoimmune disease, so this is where your immune system mistakenly thinks that a part of your body is something that's foreign and begins to attack itself. So with MS, periodically, the immune system will go into the brain or spinal cord and cause inflammation there. And depending on where that inflammation is happening, it can cause different symptoms. Many patients are diagnosed when they're in their early adult life, in their 20s, and then they will live with MS for their life.
So around about 1997, symptoms of MS really became a little more aggressive. I decided to go to a doctor, and he said to me, you could go blind and probably in about 8 to 10 years be in a wheelchair. That's when things really began to go crazy in my brain. So I told myself, I refuse to believe him. I'm going to get a second opinion. So what I want to do is talk to an MS specialist, Dr. Michael Kaufman. I told him my story, and he did something that was so phenomenal. He took the MRI film, and he began to show me MS on my brain. And I knew from that visit that I was going to see him from then on. When he retired, Dr. Donna Graves took his position. And I knew she had to be a bad girl.
So when I first met Monica after I came to Atrium Health in 2014, she was doing quite well with her MS, and she had the disease for many years. In 2020, she had a relapse kind of out of the blue, and actually had a number of relapses back to back, which impacted her speech.
I had a lesion that was on my brainstem where your speech is. And that's why I was having this relapse.
Partnering with us in terms of acute therapies, as well as she worked with speech therapy during that time, she was able to recover. We had to sort of reassess her condition. We adjusted her treatment plan at that point in time. She was able to get back her speech ability and getting back into the work that she loved.
I learned that with prayer and medication and a support system, you could get better. I'm grateful for Dr. Graves. I'm thankful for the MS Center for being supportive.
Monica's prognosis is great. It makes a huge difference. She has a very positive outlook, so I expect that she will do well. And that's true for many of my patients. So most patients with MS can be managed, and they can live very full, complete, active lives. And in fact, I think when they do that, they tend to do much better with their disease.
I am not allowing multiple sclerosis to be my life. I'm living my life. Multiple sclerosis is just a part of it. And here I am doing what I believe God has called me to do. And I'm thankful and grateful.